Hi, my name is Jessica Hundley. I'm presenting my capstone project for the ADN to BSN program at FSCJ on an approach to team nursing to prevent nursing burnout. Healthcare is developing at a fast pace and it's ever changing. We're constantly being asked to do more work in the same amount of time frame that we've always been given. According to Rushton, Batchelor, Schroeder, and Donahue, 1 in 5 nurses plan to leave their current position within 1 year. A priority for the nursing team would be to create a desire for teamwork and a sense of belonging. Some of the ways this can be accomplished is by recognition rewards, accomplishment meetings, bonding over lunchtime, letting your employees know the value that they add to your workplace, listen and solicit feedback, and employee satisfaction surveys. And this information is according to Lockhart 2015. The purpose of my presentation is to investigate the rate of nursing burnout and why that might be happening. The goal is to find a nursing model that's supportive of the current ask of myself and my colleagues. Nurses love to care for patients, and when that fulfillment is taken away due to increased demands, it warrants further investigation. My PCOT statement is as follows. In dermatology clinics, does developing several mini clinics within the clinic support a new approach for team-based nursing compared to present clinic practice, cause less burnout among its employees, and increase staff and patient satisfaction over a 3-month time period? So that begs the question, what is a healthy nurse? According to Stein-Weidel, 2015, a healthy nurse, healthy in the full sense of the word, is one who's able to promote health and safety of others and has wholeness of character and integrity, and is able to maintain professional competency and grow professionally. In my research article, according to Rushton, Batchelor, Schroeder, and Donahue, scores for emotional exhaustion and depersonalization were 1 standard deviation higher than the mean standard sample in the medical profession. Levels of moral distress were much higher for nurses in the clinical care environment. Spiritual well-being helped to decrease emotional exhaustion and depersonalization, and physical well-being was associated with personal accomplishment. Emotional exhaustion is the first step in the burnout. Strategies such as mindfulness can help nurses function in high-stress environments without becoming overwhelmed. Exercise, healthy eating, and sleep may decrease burnout, even if that exercise is only 15 minutes a day. That's according to Rushton, Batchelor, Schroeder, and Donahue. Self-care classes for nurses could be beneficial. Instead of quarterly department meetings, nurses could meet to discuss healthy eating, with samples of course, ways to increase sleep, and what's the benefits of increased sleep, guided meditation, yoga, or walking over a 30-minute lunch break. My PCOT was unable to be definitively answered because there's not a lot of supporting literature on team-based nursing. However, there is a lot of research to back up the fact that nurses are feeling burnt out at a high rate and that something should be done to address this problem. When our minds are clear, we can provide care to the top of our scope and ability. I have included a stress survey so that you can gauge where you fall on the scale in relation to your field of study. Exercise. No one necessarily likes to hear that word, but it doesn't have to be excessive or strenuous. It could be as simple as just getting out of the office and taking a quick walk outside. I've also included a video on mindful breathing, and it's a short 3-minute video that might be helpful. According to Lockhart, some benefits of exercise include increasing one's mental state and escaping a stressful work environment. This helps us to perform better care for our patients. Make sure to get adequate rest, Drink plenty of water and eat a diverse, healthy diet. It's important to come together as a nursing team to problem solve or share information. That way we don't feel so alone. We work hard for our organization and do a great job. Make sure to take time and recognize your own efforts. In conclusion, we can make or break the morale for our team. We want to be healthy, our healthiest selves, so that we can support our patients and provide top care. Let's support one another and come together to resolve the issue of nurses feeling burnt out from the profession that ultimately brings us so much joy. And please review the following references.